In this morning's Health Watch, type 2 diabetes. Nearly 18 million Americans have been diagnosed with the disease, and experts believe that another 6 million have it but don't know it. A new study out this morning says that earlier screening for type 2 diabetes could reduce the number of deaths. And our Dr. Jennifer Ashton is here with the details. Good morning,
Good
Doc.
morning, Maggie.
So type 2 diabetes is the most common form of diabetes.
Right.
What are the recommendations for screening right now?
Well, the current recommendations for an average risk person are that screenings start at the age of 45 years of age and occur every 3 years thereafter. Now, again, we have to qualify. That's for an average risk individual. We'll talk about what qualifies as high risk in a bit. But again, this is something that knowledge is power. If you don't know you're at risk for it, or if you don't know that you have it, you can't be very aggressive about preventing it or treating it.
And this study says you should screen earlier. Who do you recommend start screening
Okay, well, the
earlier?
big risk factors here, and we hear it for other diseases as well, family history is the most important one. If you have a family history of diabetes, obviously that puts you at higher risk. If you're overweight, and we know now that of American adults, that is almost about 2/3 of the population. If you have high blood pressure, certain racial or ethnic backgrounds are at particularly high risk. African American, Latinos, people from India, Native Americans, very high risk, and women who've had gestational diabetes or who have polycystic ovarian syndrome, also at higher risk and should be screened earlier and more frequently.
How early?
Well, this study in The Lancet suggested that potentially starting at age 30, but again, this needs to be individualized, and you need to know to ask your healthcare provider, you know, if you have one of those risk factors, maybe you should start earlier.
We're seeing more obese children in this country, and therefore the instances of type 2 diabetes in children are also increasing.
Absolutely.
How do you know when to get your child screened?
Well, the pediatricians are getting much more aggressive about this, Maggie, and they're suggesting that as young as age 10, if your child is obese, again, if you have a strong family history, or if there are metabolic issues, again, like polycystic ovarian syndrome, which can affect teenagers, you want to start earlier, and that is the most important thing. This is no longer a disease of older people. We're seeing it younger and younger.
So how do you screen for this?
Well, this is very interesting, actually. Most people are familiar with a fasting blood test. That was kind of the old school way of testing, and it was a little annoying. You had to come into your doctor's office or clinic after not having anything to eat or drink after midnight the night before. So again, a little limiting. Now there's a newer kind of screening method. It's not a new test, but it's the A1C blood test, and there are meters such as this one, very similar to the meters that diabetics use to check their blood sugar levels at home, which can check this A1C level. And what this tells you is
you just take a little blood and put it right there?
Exactly. Very simple to do and can be done at home. What this tells you is the amount of blood sugar that your blood cells have been exposed to over the last 3 months. So a lot of new data in the medical literature is suggesting that this is a better way to screen, and you don't have to be fasting. Diabetics already know about this because this is what they use to monitor the control of their blood sugar.
I was surprised how many people have it and don't even know it.
That's right.
For them, why is it so important to detect it early?
Well, you know what? There's this stage called pre-diabetic, or borderline diabetes. And if you are at risk, you're getting an intermediate level on this A1C blood test, for example, or you have risk factors, you can start modifying with weight loss, exercise, diet, and reduce your risk by as much as 58%. Knowledge is power. You want to get ahead of the game.
Thank you, Doc. Dr. Jennifer Ashton.
A lot happens early on The Early Show, weekday mornings on CBS.